Welcome, everybody. My name is Jennifer Terai, and this is part 3 of the Road to Reopening series with Cadre and SVCN. For those of you who are new to SVCN, we are the Silicon Valley Council of Nonprofits. I am, as I said, my name is Jen Terai. I'm the Director of Learning and Member Engagement for SVCN. And SVCN is a member organization for nonprofits in our area. We provide support in the form of policy development, advocacy, and we provide learning opportunities, such as this one, to support staff at nonprofits at all levels of work. At the start of this pandemic, we joined forces with Cadre, Collaborating Agencies Disaster Relief Effort. And Cadre, for those of you who are not aware, is the official local voluntary agencies active in disaster. That's VOAD for short. So for those of you who are familiar with Cadre, Anna is not here today. She is taking the day off, which is well-deserved. Same with Marcia, and so you will have me today. We are presenting this workshop series as a way to support the nonprofit sector in reopening their office space after sheltering in place for the last, how many months has it been now? 3? This particular workshop is focused on providing strategies to support staff that are experiencing chronic and sustained stress, might have fears of disease transmission to themselves and their families, might have secondary trauma from providing services to community members, and can experience heightened needs and fears, might change, and experience change management stresses from new ways of doing business, including using technology and being away from colleagues. So we have a lot of content to cover today, and we have a great panel discussion with some wonderful people. But before I introduce our speaker, I do want to go over some logistics. If you are not yet familiar with the Q&A function of Zoom, you'll see a little icon at the bottom, and that you can use to enter your questions. We want to make sure that you're entering your questions in that box, because we're going to record the answers to those questions for you, and we'll share them with you after this webinar. And you can use the chat function to let us know that you're here, but we ask, don't ask your questions in the chat box. We want to make sure we have all the questions in the Q&A section. So I cannot reiterate that enough. Let's see, the other function, the other thing is that I want you all to know that we are recording this session. So I will share the recording after this, and I will send a thank you email to everyone who has registered. So please keep an eye out for that thank you email. The evaluation for this workshop will also pop up as soon as we close the session, so check that out. Before I introduce Imelda, whose lovely picture you see here, I do also want to let you know about some other things that SVCN is working on. So the next session in this series will be on July 21st, and that will be focused on saving on rent. So we will talk about how to share space, and that could be with other organizations or other entities. So check us out, register at svcn.org. Have a couple of workshops coming up, and with doors reopening, or organizations reopening, and people interacting with community members once again, the census is still important, and we want to be able to provide tools for your staff to be able to talk with families and engage those hard to count communities so that we can ensure a more complete count. The census is important because that does get us federal funding for important services that all of you are providing. So I encourage you to send your staff to these workshops. Also find the registration links at svcn.org. Oh, and just one note about this is July 15th will actually be an evening session starting at 6:30 p.m. So for those staff that are usually unable to attend webinars during the day, that's a good opportunity to have them attend an evening session about the census. SVCN, if you haven't seen it yet, we published a solidarity statement with our sister agency, Thrive Alliance for Nonprofits. So I encourage you to check out our website. We have that statement posted on our website, and we want to get feedback from everyone in our community about what kind of resources and tools you want us to include on our race, equity, diversity, and inclusion page. So again, svcn.org, cannot say that enough. And another major event that's coming up is the Funding Your Impact Summit. So if you have not heard of that before, it's our annual summit focused on fundraising and development. I currently have a call for speakers out, so if you know any amazing fundraisers who have been able to adapt to a virtual world, please let me know or send them over to svcn.org to check out our call for speakers. They can still apply to be a presenter. And lastly, as I mentioned, SVCN is a membership organization. And if your organization is not yet a member, please consider becoming a member today. Member benefits do include discounted prices for events such as workshops and summits. We also provide some member exclusive events such as policy forums. We have an annual membership meeting, and we offer technical support to all of our members. So join as a nonprofit member. We also have a new ally membership for foundations, corporations, other businesses, and individuals. So check us out, svcn.org. And I will share that later. So on that note, I want to introduce Imelda Gonzales. She is the VP of Human Resources for the Silicon Valley Community Foundation. Correct me if I got your title wrong, Imelda. But, I just want to say a few words about Imelda. She comes from a background that is, much more diverse than just human resources. And through my conversations with her, I see that she takes her job very seriously and really cares about the people that she works with. So I'm actually very excited to have her present for us today and to moderate our panel discussion later. On that note, I would like to introduce Imelda and let her take away the screen.
I beat you to that. Hello, everyone. Thank you, Jennifer. Thank you all for joining us today. I think that, we are, if your email inbox is anything like mine these days, you open it up and you have all sorts of webinars to attend, invitations. I think all of us could spend most of our day listening in on webinars and participating. So I thank you also for electing to join us this afternoon for what is hopefully a useful conversation for all of our nonprofit partners. Jen already did the housekeeping. I want to delve a bit into the agenda here. I'm going to be using SVCF and what we've done at SVCF as sort of a case study and a jumping off point for our conversation later on with our panelists. So we'll move on to a panel discussion, a Q&A, and then there's closing and next steps. I wanted to start off with this quote. It was shared with Silicon Valley Community Foundation's all staff at an all staff meeting by one of our board members, Rebecca Guerra, and it really resonated with me. We're in an industry, in a sector where we are helpers. Our staff are helpers by nature and by vocation. And, again, hoping that today's conversation provides you with ideas and insights and some connections around what other organizations in our sector are doing to help support their helper employees. I grew up watching Mr. Rogers, and it's also, I think, fascinating and interesting to have his presence revisit us in all times, and in good times and bad times, and in challenging times. So I'm moving on. So I also wanted to spend a little bit of time thinking about where we are right now and what we know. I've sort of, used this slide as more of a reflection in terms of, we've been sheltering in place now for 3.5 months, and this is still a new situation for us. If we think about, that slice of time, it isn't a lot of time, and a lot has happened, and there's a lot of shifts and changes, and the ground still feels a little unstable, even though we've been settled in place for a bit. I don't know about all of you, but I feel that I'm oftentimes reinventing wheels. And so I really appreciate these opportunities to gather and share with other folks at other organizations and learn from them, so that in a sense it provides a community to reinvent wheels together. One of the things that I keep going back to is muscle memory. I think in all of our work, in all of our jobs, in all of our personal lives, we often rely on past experiences to inform and help us drive through and meet our goals and what have you. We really don't have muscle memory for this. You know, I can't think of, in the time that I've been in, specifically in the in my HR career, now over 20 years, where I've been able to, like I can't draw upon many things for this. I've talked to colleagues who have been in the field for a longer time, specifically during the Loma Prieta earthquake many moons ago, and they don't find the situation to be analogous. So again, you know, this reinventing of wheels, so we don't have this muscle memory to rely upon. And staff are looking for guidance and resources from us. You know, I think that that's always been the case, but more so now. There are a lot of questions and we don't know or have all of the answers. I think, you know, especially if I reflect upon the early days where, you know, it was this bombardment of like, let me look at all these public health pages and the Johns Hopkins pages, and, you know, trying to be 1 or 2 steps ahead of staff. And oftentimes, you know, they would beat us to the punch and have more information than us. I think that, you know, we've come into a cadence where we know where to seek out information, especially around public health. And, you know, we remain in an industry where staff are passionate and mission driven. And that passion and engagement with the mission oftentimes leads to them overstretching themselves. This is, you know, this is why many of our organizations exist, for these times. And we also have to think about, you know, the people that make up our organizations. And I mentioned this earlier, you know, just sort of sifting through information is increasingly hard and time consuming. Again, I have so many emails from all sorts of different organizations every single day, pointing me to different sources of information for staff, and specific information about public health, specific information about face shields and masks and PPE. And so, you know, again, this sort of management of information is can at times be a little overwhelming for us and for staff. And I wanted to share a bit about what SVCF has done, also recognizing that SVCF is a bit of a unique organization. Unlike many of the organizations that are represented on the panel and are on this call, we are not a direct service organization. Our direct service looks a little bit different, so I want to call that out. And that's why I'm really happy that we have a diversity of organizations that are represented on the panel for later discussion. So 99% of our team has the ability to work remotely. There are 1 or 2 people who come into the office once a week, twice a week, to sift through mail, because we still receive mail here, and also to record podcasts and such. I happen to be in the office today because my email is a bit, my internet's a bit precarious where I live in downtown San Jose. So I thought that I'd, you know, come in and we've been working remotely since mid-March. You know, one of the questions that I often have, and I will use these questions just as moments of pause and reflection as we move through the slide deck, is how are we ensuring that that working remotely is inclusive? In our initial conversations, Vicky brought up, and I thought it was important to also bring it up here, is that a lot of our employees are also impacted by the digital divide, or may not be able to upgrade their services because they might have someone in their home who is immunocompromised, and, you know, having some, you know, staff from AT&T or Comcast come into their home poses a risk. So also thinking about that, you know, that piece where at SVCF, we are a population that has that ability to work remotely, but also reflecting upon that that's not every population. And we have had our challenges here as well in terms of, you know, again, like personally, my own spotty service. One of the things that we started doing from the very beginnings when we kind of had an inkling that we might need to shelter in place even before that was the term, was we increased our cadence of communication. So for in the first couple of weeks of being working remotely, we did staff emails every single day. We increased this, the cadence of our all staff meetings. We had them once a month. And so now they're every 2 weeks. And we've continued that. We also increased and encouraged teams to increase their team meetings, whether it was a daily huddle check-in or more extensive conversations. We also happen to be in a particular time in our history here where we're in the development of a new strategic plan. So teams are meeting more frequently and there are those touch points. So in terms of keeping communication going with staff. One of the things that we've also done is we've used multiple channels to convey information. So email, Slack, meetings using Zoom. I think that, you know, we have, again, a diversity of staff and they all kind of seek out information in different places. So we've used these platforms that were already in existence and sort of replicated the messages and the communication on all of these different platforms, and also using our own hub, which is our own intranet. Around employee engagement, one of the things that we thought important as we're thinking about our return to office is surveying our staff. And having been doing surveys for now many years, especially around staff engagement, I was really taken aback at the quick response rate and the total response rate to our employee engagement survey. It was almost at 100% in a matter of 48 hours. This really speaks to how staff are feeling around it. In terms of the employee engagement survey, if anyone is interested in the tool, it's about 20 questions. We deployed it on SurveyMonkey. Feel free to reach out to me after. I'll gladly share the tool with you. I've sort of taken open source approach to some of these work products. So in terms of like sharing and not reinventing the wheel. And we also adapted some of our rituals to virtual environments. We have this coffee talk that was just that in the mornings, the first Friday, where staff gathered and for coffee and bagels and fruit. And it was just a chance to spend some time together chatting. What we've done with that is we've turned them more into learning sessions where we've engaged with donors to come and talk about their philanthropy journey, especially around COVID. This Friday, we're hosting some of our community leaders that lead nonprofits and talking about the work that their organization has been doing in support of COVID, but also in support of the Black Lives Matter movement. The other thing that I want to add is, you know, like I mentioned earlier, we have been working remotely since mid-March. And I think like many organizations, we've been moving that goalpost for reopening. It is currently, we're currently scheduled to reopen in September. But again, given the news that came out on Friday, we're rethinking that. And our plans to reopening were not to sort of in a sense, so we're not to force the situation, but take volunteers. Those that for a variety of different reasons were interested or are interested in coming to the office and working with that group of staff in terms of reopening. Right now, our reopening plans are up in the air. You know, there's a couple conversations that still need to be had, but, you know, again, you know, being vigilant around public health, and also being vigilant around our employee concerns and anxiety. And again, I want to reemphasize that we are, again, an organization that works a little bit different than some of our direct service partners, you know, where we have that ability to pivot and work from home and take some of our processes and procedures to a virtual environment in an easier way where it doesn't necessarily disrupt the relationships that we have with our community partners. Other things that we've done is we've done training. So we did managing remotely for managers and supervisors, and we continue to also engage on that on our Slack channel. So we created a Slack channel for supervisors. And other things that we've done around our benefits and flexibility is that initially we offered staff with we offered additional sick leave for staff, and then the CARES leaves kicked in, and so we switched to that. We've been highlighting existing benefits, especially EAP, and some of the mental health benefits that are offered through our medical plans, and we added a mindfulness app. You know, I think it's again sort of trying to tap into the different sectors of our employee population, and there was a need for this, and you know, we found a company that offered a great nonprofit discount too. So if you want some information on that, feel free to reach out as well. We've established hours of operation. Again, you know, that's been established, but we've allowed for flexibility to meet individual needs, especially around childcare and when school was in session, you know, parents at home and, you know, taking care of their children and their schooling. Also in homes that, you know, being cognizant that there are homes that are multi-generational, and sometimes you have a whole variety of different folks that are on the internet, and that also causing some issues for staff. So, you know, we've taken an approach to customizing our flexibility to one-on-one situations. The other thing is that, you know, especially on the HR side, sometimes we've been privy to family situations or employee situations, and we've proactively reached out to staff, especially around some of the leaves, around some of the flexibility that's offered for scheduling. I think that like one of the things that I should have said is we're a fairly lean team where there's only 2 of us, and our staff population is about 114. So, you know, and the other thing, as I say that, I also want to acknowledge that, and I should have done this on the front end, is that COVID has created a whole other work stream for us as well, right? So it's juggling those pieces that are already complex of our organizations and our job, and then adding the, you know, more complexity around COVID and all that comes with it. A couple things that I want to highlight around communication is we found it important to share information in an accurate, timely, and transparent way, whether it was through email, through all staff meetings, or cascading it down through managers, and communicating consistently, even if there isn't anything new. And sometimes that was just simply an email wishing people a restful weekend. Whether you're, you know, if you've increased the cadence, you know, keeping with that cadence and keeping consistent with that cadence. And if you happen to scale back, let staff know that maybe those once-a-day emails are scaling back to 3 times a week or twice a week. But, you know, otherwise people are kind of like thinking like, well, what else is going on that I'm not being informed about? Having 2-way communication and mechanisms for feedback we thought was really important at SVCF. You know, asking the question of, do staff know where to get information and who to provide any feedback or insights to stressing open door policies. We have open calendaring, so that's a way of moving that to a virtual environment. It's important to us to have an open Q&A during our all staff meetings, where staff are encouraged to ask questions of the content that's presented during the all staff meeting, or of other questions, challenges that they may have. Again, staff surveys. We're going to continue to survey our staff as we move through this particular situation. And something that I thought just sort of, that I've observed is like an uptick. We have a Slack channel where we have shout outs, but there's been an uptick in that. There's also, we provide space and time during our all staff for shout outs. And, oops, excuse me. And as I think about making staff well-being a priority, I think about some of the underlying philosophies there, and thinking that staff want assurances that that our organizations are going to put them first. This comes in the form of like health and safety, and especially those organizations that might have a hybrid model and did not move to a work from home situation or working remotely. Seeing that that as an organization, we have a quick response to implementing public health measures and advice. But working from home, having flexible schedules and when appropriate, because there's still operational pieces of our organizations that need to continue. And reopening plans. To us, it was really important for them to be very much entrenched in our values. This organization did a lot of work in the last year and a half to really codify and live our values and to be people-centric. And one of the questions that I ask of my colleagues, of you that are working toward reopening plans, asking you to reflect on what's the driver to reopen, especially in those situations and those environments where many staff can continue to work from home, and when work still continues to be, and they've been working from home or they've been working remotely, and their work still continues to be effective, efficient, and impactful. So it's just something to think about. And I started thinking about that after having a conversation with a friend of mine who is a COO at a large nonprofit in LA, and she was talking about the accounting staff and how the accounting staff had gone back to the office. They had been working remotely also for a couple months, and in going back to the office, there were some concerns and anxieties, especially around proximity to other colleagues. And she did some delving into why, with the leader of the team, as to why that move to move back into the office. And I was really struck by the answer, in that this leader wanted a sense of normalcy. And I think we need to take some pause there and think about how and when we do work, and does it continue to be effective, efficient, and impactful? And also thinking about how we redefine normalcy in this, during COVID, post-COVID environment. I want to also take the time to, to recognize, and it's something that we've been, working a lot on at SVCF, that all staff are doing some extraordinary work during an extraordinary complex time. And so a question to you out there is, what is it that your organization is doing in terms of celebrating and appreciating staff during this time? We've been doing some work around, staff social hours and, being inclusive in that, and also really beginning to codify more and institutionalize how we recognize staff. And I also want to, one of my parting thoughts here is leaving you with that our attention or inattention to employee well-being at this particular point in time, will have reputational consequences, positive or negative. So really thinking about how you approach staff and their well-being, and the process of reopening, and how you take into account their thoughts and concerns is really important, I think, at this time. And before we move on to the panel discussion, I've just sort of given the times I've been reflecting upon this quote from Thurgood Marshall. And the measure of a country's greatness is its ability to retain compassion in times of crisis. If I scale that down and think about organizations and places of employment, this is also, this will speak to, I think, our reputation and our greatness as organizations, as to whether, how we work with staff and address concerns and challenges during times of crisis. At this point, I want to start to introduce our panelists, and I'll give them an opportunity to introduce themselves and tell us a bit about their organization in the next couple of minutes. And before we move on to that, there were a couple of questions that came through from all of you on the registration site. So I want to take I want to take a couple of minutes here, or a minute, to address one of the questions that came through. And so the question was whether organizations should be providing equipment or stipends for use for staff to offset any costs in terms of phone. So in terms of phone and internet, the state law does require that employers don't pass on operational costs to staff. That law does stop short, though, of providing any guidance as to how much staff should be provided for. At SVCF, we've done a couple things. We've allowed staff to come into the office in a kind of setting up an appointment system to retrieve chairs and monitors and some of their ergo equipment, supplies. And we've always provided a phone stipend for staff. At the onset of being from working remotely, we started providing stipends for computer use if they didn't have a laptop here at the office, so if they're using their own laptop, or and also for internet. In terms of supplies, we have an order system, so where where the staff that does come into the office packs up supplies and then mails it off to staff to their home. So those are just some ideas there. But at this point, I'd like to move on to our panelists. And so I'll start with Barbara. And the question will be for everyone. So can you introduce yourself? Tell us a bit about your organization, the size, if you have pivoted to working remotely, and where are you in your reopening plans?
Thank you, Imelda. So my name is Barbara Willits. I'm the VP of Human Resources for Second Harvest of Silicon Valley, previously known as Second Harvest Food Bank for Santa Clara and San Mateo counties. So we do support both counties. We have been in a hybrid mode since March. So we are in a very essential service. We've actually doubled the number of people that we serve in the two counties and the amount of food that's going out to serve folks. So we have, well, about half of our regular employees are working from home. The other half are in every day, and we have more than doubled our workforce with a combination of temporary employees, California National Guard, City of San Jose employees, San Jose Conservation Corps, and community volunteers that work in our buildings. We have another 300 to 400 community volunteers who are working at the sites to distribute food. So it's been a very interesting challenge for us, given that it has changed our business so entirely. And we have this hybrid, so we have half of our folks, and it presents a lot of challenges from a communication and cultural perspective as well, because we have these two distinct groups, and we can't gather the folks who are on site in any way. And I apologize, Imelda, I want to make sure I'm answering the full question.
Yeah, you did. Let's see. Let me also revisit it. So, introduce yourself. Tell us about your organization, size, and how you have pivoted to working remotely. And where are you in your reopening plan? So, you're a hybrid.
Right. Yes. And so we are also trying to understand, and as those who have not been in the office, we have, for the half our staff, we have plans right now that we've just started to work on to understand how do we bring folks back in. And our first group that we want to bring back in is the folks who actually want to come back in. So we have not made any determination about bringing everyone back in. We're very open and listening to our staff on what they're comfortable with, but we've also heard from some staff they would like to come back, even though their jobs were deemed ones that could be done from home. So that's the group we want to try and accommodate first.
Okay. Thank you, Barbara. What about you, Vicky? Can you share a bit about your organization?
Right. So my name is Vicky Davis, and I'm with Peninsula Family Service. We have 3 programs between San Mateo and Santa Clara County. Our largest program is early learning, childcare from 0 to 5 years old. Our second program is older adult services. And our third program is financial empowerment. We have been closed since the beginning of March as well. All of our staff was working online. We were able to continue to engage our teachers, which was so important. That provided us the opportunity to actually create curriculum. And it also enabled us to continue help reach out and support with our families that were struggling during this period of time. We have an organization of about 140 full-time employees. And as of this week, we decided to open one of our child care centers. Today is their first day, Tuesday. So we are following CDE, California Department of Education's regulatory, no more than 10 children in a classroom, and we're following their protocols. It's interesting that our parents are actually on a wait list to come back. So they're really ready to come back to provide the services.
Right, thank you. Letitia? You are muted. Let's see. Okay.
Okay. Hi, my name is Letitia Campbell, and I am the Senior Operations Manager for Love Never Fails. We are a growing nonprofit organization with 22 employees. We're located in Hayward, California, and we have multiple office locations throughout the East Bay. We're dedicated to restoring, educating, and protecting survivors of human trafficking and the communities that they live in. So please feel free to visit our website at www.loveneverfailsus.com. I'll also put it in the chat to learn more about the services we provide. Currently, we remained open during the shelter in place, with the exception of closing our store. We have a community store here in Hayward. Our employees were working both from home and in the office, and we are now back to our normal business schedule, and we plan to reopen on August the 1st. And due to the COVID-19 shelter in place, we haven't been able to utilize our volunteers as much as we did in the past, but our current volunteer base that we do have, we're working remotely with them, and they are working on administrative tasks for us and also program planning. Oh, thank you.
Thank you. Roseanne.
Hi, I'm Roseanne Gompertz. I'm the director of the Faculty Staff Help Center at Stanford University. So I just want to preface what I'm saying is really about our group. We're an employee assistance program for staff and faculty, postdocs, and family members up to age 26, as well as for the both hospitals. So it's a large benefits group. But what I'm saying is just for our group, the Faculty Staff Help Center, not for Stanford University as a whole, because that's a giant organization. We have about 14 folks on staff, mostly part-time. We have been working completely from home since the middle of March, and are working on some plans for potentially doing a hybrid model, again, with people who are open to coming in. Because right now Stanford's saying they're going to have 50% of students back on campus, which means there's going to be a lot more staff back on campus and faculty, where they won't be able to do confidential sessions at the office. So people may want to come in, and we're working on how to manage that. Unfortunately, doing therapy and counseling and consultation in a small room for an hour is, sort of not the protocols that anybody wants to look at. That's so not being outside and being in extended time is difficult. And none of the clinicians at this point feel comfortable doing their work wearing a mask with the other person wearing a mask. It's just, you lose a lot on Zoom, but you lose a lot that way too. So we're working on possible hybrid plans. So I think that's it.
Great, thank you. Just in terms of like kind of a theme that I heard is that, in terms of those that are going to be reopening is, looking at bringing back staff who want to come back. So I kind of going to pin, just highlighting that piece there. Kind of moving on to another question that came in prior to this conversation, and this is an interesting question. And how has COVID-19 and the Black Lives Matter movement affected the way that you're handling employee relations issues, terminations, and/or layoffs? Are you handling them just as you were before the shelter-in-place order, or have you changed your approach? Vicky, can I start with you?
I have not changed my approach, and here's the reason why. I am a strong believer, and I'm really committed to diversity, equity, and inclusion. And so my hiring practices are very open and very inclusive. What's more important is my performance management. So I've actually provided and trained my managers in the short year that I've been at Peninsula Family Service, what is performance management? And it's really based on work and outcomes and setting expectations. So I have been able to really move from the perceived favoritism because we're more transparent in our actions. If we do have to, if someone isn't performing appropriately, they're very clear. Here are the expectation, here are the opportunities that we provided for you to correct. You are an adult, you change those behaviors, but we can actually show where we have progressed, given them a process to either change the behavior or really re-examine if this is the appropriate organization. Now, let me back up and say that it does take a lot more energy and time, some in which the managers don't. But I have been very fortunate at Peninsula Family Service that the senior leadership team really, really values diversity, equity, and inclusion. And so we've done a lot of work around, equity in the organization. What does that look like? Yes.
Mm-hmm. Okay, thank you. Thank you for that. Letitia? can I move on to you for a response to that question?
Sure, thank you. So our organization, we basically have continued to work in the same atmosphere as we did previously to COVID-19. There is a strong diversity within our workforce. We have multicultural staff here, and we do everything that we can to make sure that everyone is working in an inclusive environment. We have a life coach actually that coaches our staff and also our residents. And with that being said, everyone has the opportunity to express how they're feeling. We have an open door policy with the management and leadership. We give everyone an opportunity to bring their ideas to the table. As far as the communities that we serve, we are we're currently a Cisco IT certified networking academy, and we're state certified in cybersecurity and pre-apprenticeship programs. And these programs equip Black and Brown people for careers in IT. And they also speak life into them so that they believe that they can actually achieve goals of becoming an engineer or a salesperson or a marketing lead, project manager, just working in a corporate environment. So given the state of like even Santa Clara County, when you look at the diversity within the race population there. So for example, in Santa Clara County, there's a different challenge going on in the communities where the median salary is about $126K, and only like 8.6% of the population is living below the poverty line. And 84% of them have graduated from high school. So one might think, well, there's really like no challenge there. But there is, because only 3% of Santa Clara County is Black. So that estimate is roughly about 40K of the residents are African American. And if you look into it further, you'll see that the reason that they're there is due to multi-generational reasoning. So let's say their grandparents purchased a home and the home has stayed in the family. So now the grandkids are living in the home, but although they're living there, it just provides a place for them to stay. You know, they may not be employed, or they may have been incarcerated. They have a lack of education, so there's no opportunities for them. So one area in particular there in Santa Clara could be like the Seven Trees area, where like the median income there would probably only be about 53K for those people that live in those apartment complexes. So what we like to do here at Love Never Fails is we offer a Itbs program through our workforce development program. And if you go online, you will see our program there, and we are offering all of our classes for free in the community. We have an entrepreneur class, we have a Google cybersecurity class. We actually have two pathways. There's a Google pathway and there is a Cisco pathway. So if any of you know anyone in your community, you know, young adults that are interested in learning about cybersecurity or IT networking, please send them to our website, because we are trying to make a difference in the community, trying to provide jobs. We have apprenticeship programs that we are working on with San Francisco City College for students that go through our Google IT class. So we, you know, although this is all happening with, you know, the race relations, Love Never Fails has been, you know, trying to provide a pathway for Black and Brown people to be able to get sustainable jobs and be able to live viably in the communities that they grew up in.
Thank you, Letitia. I think that's really important work. And I think that, you know, just sort of as a side note, something that, especially those of us that are, that are working in nonprofits, and especially those that are doing direct service to clients, is that, and this is something we've known all along, but it just has become much more amplified under COVID and also under the Black Lives Matter movement, is that there is a huge wealth gap in our communities, whether it's Santa Clara County, San Mateo County, and across the region. So thank you for providing us with a little bit more information about the organization and the important work that you're doing. Turning it to Barbara, same question. Has COVID and this particular political moment, has that had an impact in how you're handling employee relations issues, terminations, layoffs, and such?
It has not impacted our process, because similar to how Vicky described it, we really tried to have a process that's very equitable in how we do all of our performance management. And so we're sticking with that process, because no one should first leave without understanding and having opportunity to change their behavior and change the performance and be treated as an adult. We've been very fortunate. Because of the nature of our business, we are not in the position of having to look at anything like layoffs. So we are in a growth mode. So we are actually hiring. We're far more looking at how do we do hiring with a DEI lens. And I think what the recent, Black Lives Matter and then the recent protests reignited our DEI efforts. So we're not as far along as some organizations. We had a path set out for us that we put a pause on when COVID hit, because we diverted so much attention to what needed to happen to get our services ramped up to meet the needs in the community. So we've now actually reprioritized and very much are looking at what do we need to do to transform our organization with an eye and an equity and inclusion lens. So that's sort of how it has affected us. I will say that COVID has had a little bit more impact on us from a performance or disciplinary perspective. So for those, many of you wouldn't know this, but we have both a union and non-union workforce. So we actually have progressive discipline as defined by the union. And so we've modified our attendance pieces though because of COVID, and been really clear, because we don't want anyone coming in if they think they are even at the very beginnings of getting anything. And that was a little bit of a challenge for some of our managers to get their heads wrapped around when they suspected some employees may not be, they may be using that a little bit to their advantage. But I'd much rather have that circumstance than have someone come in sick. So we really, really want people to take the time they need.
Thank you. Roseanne, I'm going to turn it over to you, but also ask you to put your professional lens on the question in terms of the work that you do with staff and faculty at Stanford as well.
Yeah, I mean, I would say in terms of performance evaluations and things like that, performance management, things haven't changed, although we have a pretty small group. And so lots of performance issues happen by, people coming into my office or I walking into their office, and all of that has really changed the nature of work. So we have a 2-hour staff meeting every week, and I try to connect with people one-on-one, but clinicians have a hard time knowing what's going on in other people's offices. And now that everything's online, it's very difficult. But we have a great staff and I'm not worried about that. With regard to people coming back to work, I think many of the things that you said are also true here at Stanford, that, people are anxious about a number of things, from the unfairness of some people in groups being asked to come back while others can work from home, and how, we've heard a lot of, it's unpleasant and uncomfortable to be on a email chain where some people are exchanging, banana bread recipes, and other people are working in new groups on campus because they're needed and their work has been diverted somewhere else than they're used to working. So that's a difficulty. People are anxious about using public transportation to come back to work. People are anxious about the situation at work and the safety there. So there's a lot of issues that I think everybody's facing. And, you know, it's nice to hear that everybody on this call is looking at people who would like to come back to work. Unfortunately, that's not always the way it works. So, and Stanford, you know, may be in a situation where they're having to do layoffs. So it's a complicated time for sure. And certainly with the racial injustice and police brutality, that's raised an even bigger concern. I mean, not bigger than COVID, but as big, let's say. And the hiring, I mean, as I think it was Letitia, I'm not sure, who said that only 3% of Santa Clara County is Black. In the same way, you know, looking for clinicians who are African American or Black is extremely difficult. So something that we're always interested in. And if anybody out there knows anybody who's interested in talking to me, you can email me.
Thank you. Barbara, I'm gonna focus on you again as to help us answer this question. Also to Letitia, it focuses, there's a focus on volunteers. And the question is, how do you support or address issues with staff for volunteers in high-risk groups or those who may be living with someone in a high-risk group? And then there's a follow-up question around recruiting volunteers during this particular time of COVID.
Thank you, Imelda. So volunteers and whether to continue having volunteers or not was, we had a lot of discussion internally at the beginning of COVID. And we ultimately decided both for the needs of the community and the needs of volunteers to continue having volunteers. We messaged as strongly as we could, both in writing on our website and verbally when volunteers came, what the risks were and discourage those who had any kind of risk factor, either themselves personally or in their households, or anyone they would be caring for in a regular manner. We really strongly discouraged them from volunteering. We did not absolutely ban it. We actually had quite a few over 65 folks who wanted to continue, and after several conversations, that was their choice. And so we have continued to recruit volunteers through our standard means and some expanded. So we've recruited through our website, which has always been a really great tool for us. And we were hooked up with a lot of the businesses in the community. And what has happened is a lot of the folks who worked in high technology, for example, they're now coming in as individuals. So they went to the site, they were at home now working, and they wanted to come and help the community. And so they have volunteered to help. We also have had a great partnership with Catholic Charities. I don't know if anyone from Catholic Charities is on the line. They've been a wonderful partner through this, both doing distributions at the various parishes and supporting those, and also helping, because we've really ramped up our home distributions. And then we've tapped into other organized volunteer groups, some of which I had no idea existed before, and a couple of which I'm unfortunately not remembering the name of. So they've also come on board in a very organized fashion with their members. So that's what we've been doing. And we are very thankful to community members and very fortunate because we could not distribute the food without volunteers. They're essential to us.
Mm-hmm.
Thank you, Barbara. So currently with our volunteers, we have actually stopped the volunteers from coming on site to do any work with us. We have a outreach program that we normally would do once a month, and we would go to the streets and we would have different church organizations come in and volunteer with us. So what we decided to do was do a virtual outreach. So since we are advocates for human trafficking, we have our outreach coordinator conduct a phone call outreach that we're doing every month. So we basically go to a site that offers services for women. Women go on site and try to, or men try to order services. And we call the ladies, or we call whomever that is that's selling their services, and then we talk to them. And, we tell them that we have food available for them. We ask them where they are. We let them know that, if they wanted to have prayer, whatever they need, we just try to stand side by side with them during that time. Since we've done that, we'd had 3 women who were in the life that we were able to help in Contra Costa County that went out there and got services because of our outreach. So that's one way that we kind of changed with the volunteers, because we need volunteers to do that. So that's one way. Another thing that we're doing is we have students from Cal State East Bay that are coming to us, and they're asking us if there's anything that they can do, because what's happening with COVID, they're unable to go to school, so they have projects and they're trying to graduate. So we're lining ourselves with students to do a program where they would interpret our material into Spanish. So we're really excited about that. Within our organization, as far as the population, the vulnerable population, we have 2 employees that are currently pregnant. And one of them is a house manager. And what we've done with her is we've had her stop taking some of our residents to the store, just to make her feel at ease for coming into work. And her hours, actually, she asked if they could be reduced, and we've done that. So we are trying to help those who are in the most vulnerable population here. And at this time, like I said, our volunteers that are older, that would be in that population, we're not having contact with them. But we are still accepting people. If they want to volunteer with us, go to our website, sign up. We're still sending out our forms for them to fill out, and we're still ramping up because we know this is going to be over one day, and we are definitely going to need you. Thank you.
Great, thank you.
Imelda, may I add
Yes.
one thing? So I should have mentioned that also what we've done is shared with our volunteers all of the cleaning and safety and protocols that we have put in place. We had everyone wearing masks before it was even county ordinance, at least in Santa Clara County. And so we really try to make it as safe of an environment as possible, both at our food distributions and also for folks who are helping to box food within our warehouse sites. So that is something, everyone comes in and gets to see not only a warning, I hate to say, about what they need to be watching out for, and if they're in a risk category, maybe rethinking volunteering, but then also what we're doing to help keep them safe while they're here.
Great. Thank you for adding that. Vicky, are there volunteers at your organization? Oh, you're muted.
Yes, in our older adult services, and we just actually stopped. We just did not want to risk it. I even reached out to our workers' comp carrier, and we are covered, but why risk it? So we've just stopped. Yes.
Yeah, and bringing up workers' comp, there's a question in the Q&A box. Have your insurance liability carriers provided any information or support for policy revision, including telecommuting, working from home policies, provisions of PPE, et cetera? If you have what you believe are good written policies, would you please share with webinar attendees? From my on the SVCF, and we have a couple brokers. So we have our medical, dental, vision, health insurance broker, and we also have our commercial side broker. And both of them have provided a lot of information. One in part of the admin training for the HR and building facilities folks, but also support in training for employees who might be coming back to the office, when and if we reopen. and also support, especially around some of the changes in IPP plans and adding the COVID piece. So if you have a broker, I would encourage you to contact them. They have a lot of resources that, frankly, you're already paying for. That could be helpful in this situation. Do any of you have anything to add to that?
Yeah, I actually, this a little bit more. I come from a healthcare background, highly regulated JCO. And so what I actually finished, and I don't mind sharing it, is I did an addendum to our handbook called COVID-19 Employee Handbook. And it's really in draft form, but what I did was I pulled the information from OSHA, from CDC, also from CDE, and I talked to, our broker, and I put it all in one spot. So it does talk about the telecommute policy. I have that. I have a mask policy, a mask requirement policy. The hand washing. So it's already in one spot, because what my broker did, they were very helpful, but all they did was send me clicks and links, to go here, to go there. And, we're just busy. And so I took actually, the 4th of July weekend to put all that information to summarize it. And so I'd be more than willing to share it. I need to pull out our information, but I can share the template. So if anyone would like to use the template, they're more than welcome.
Fantastic, Vicki. I think, again, this whole, we don't need to continue reinventing the wheel if we can leverage each other.
Yes, definitely.
Okay. Anything else to add from the panel? Okay. Then let me move on to, I think, a question that have been walking around, but how are we working with staff who may not want to come back to the office? And when in the office, how are we working with staff to follow new norms, like wearing a mask and following office traffic protocols? I think that there's a lot of questions around that. One, the anxiety of coming back to the office, but then when in the office, what are we going to do if somebody refuses to wear a mask, for example? Barbara, can I tap you for that, since you have been open and you have a lot of norms?
And we are continuing to evolve almost daily, it feels like. That's actually, mask wearing is one of the gaps. So we've had the policy, and everyone understands that we have been fortunate. We haven't had anyone who said they absolutely won't. We did share with folks who were concerned about their own health wearing a mask, that if we needed to, we would do a workplace accommodation for them. So that is in place on an individual basis. And then for the rest of staff, what we are now pivoting towards, and this is literally in process, is going away from trying to talk about enforcing it, and really starting a campaign that wearing is caring, and educating our staff that when they wear their mask fully, it's really caring about their coworkers and their colleagues. It's not about themselves. But however, if we're all doing it, then we're all protecting ourselves and each other simultaneously. So that's really where we're going to, and to really hopefully heighten our staff awareness. We're going to be doing some additional education with that to ensure that people wear their masks as fully as possible, recognizing that reality in a working warehouse is sometimes people need to pull off their mask for a moment or two to breathe. And so we have to allow for both to happen.
Thank you. And I love that. Wearing is caring.
I have to admit, I think one of our staff, I did not come up with that, but one of our staff saw it in a public agency not too far from here, not in our own county, and it's not copyrighted, so we are adopting it our circumstance.
Vicki, can I turn to you for some input?
Yeah. So, legally, if you want to talk legal, you know, per the OSHA Act, we cannot, if an employee feels that their lives are in intimate danger, we do need to do an accommodation, but the employers actually do have a legal right to set the policy that masks are required. We're not in the office, so none of this is all theory right now.
Yes.
Since, you know, we're working from home. And then even when we open this week, I mean, we're working with kids, so you cannot wear masks, you know, when you're working with kids. But employers do have the right to make it a policy, and they do have a right to discipline if they are refusing. And the question is, if they are actually are afraid to really come into the office for whatever reason, you know, we do have the CARES Act, you know, that additional, so that doesn't run out until, you know, the end of this year. And also, as of July 1st, paid disability leave is now from 6 weeks to 8 weeks. And then on top of that, you also have FMLA. So there, you know, employees have a lot of rights that they can turn to and that we have to abide by from the beginning. But I really like what Barbara said is, you know, wearing a mask is caring. And I really like the idea about that campaign, but you're going to always have those outliers. Yes.
Yeah. You know, we're running close to time here. And I think, you know, I'd like to ask this question of all of the panelists. And so I'm wondering if each of you can share a thing or two that you've done at your organizations to better support staff. You know, in the chat, I saw that there was a virtual retreat with cityhunt.org. I'm definitely writing that one down for our staff, but I'm also kind of curious to know what you may have done around staff engagement and, you know, again, you know, in support of staff to make them more, you know, having them feel more secure around, you know, this whole piece. I will start with Letitia.
Hi. So what we've done here is we provide lunch for our staff. We've been providing lunch at least once a month to our staff here that's on site. We also have activity that we call Fun Fridays, where everyone gets together and does something fun on a Friday, whether it is a hike in the Hayward Hills, or it's going to the marina to walk around, or it is having a little barbecue in the back. So we've been doing those things. And again, as I mentioned before, we also have life coaching for our staff as well. So that really gives them a chance to kind of debrief and, you know, talk about the stressors and the things that are happening here at work, and allows them that time to kind of connect back with themselves. So those are the things that we're offering now.
Great, thank you.
You're welcome.
Barbara?
Okay, so I'm going to try and answer for sort of both our populations. So for our staff that has remained on site, we actually are really fortunate. We're able to do lunches daily. We did have a funder step up and help with that. And we also have been able to offer what we're calling essential services pay. So there's an additional pay piece that they are all receiving. For all of our employees, we offered a disaster relief reimbursement, which is something that is in the tax code. I am not the best person to explain it. Our CFO and our tax folks are a bit better, but it actually was available. I believe it's available to certainly all nonprofits. I don't know beyond that. And so we were able to give a cash payment to our employees to help them offset their costs of working from home, whether they needed equipment. Someone recently was talking about thermometers, even for their families, anything that's associated with COVID and how they've had to change, they can use that money for. We also put in, before the CARES Act came up, our FCCRA, we created what we called infectious disease leave, which was an additional 10 days of sick leave. And even once the government came in with their program, we have maintained that additional time. So our folks have quite a bit of time. And again, that's in part recognition that we are working, I mean, we're working 18/6 every week with folks in our buildings. So we really want to take care of the folks. And then we've done Zoom all staff calls for folks who are working from home.
Great. Rosanne?
Sorry. You know, Stanford does offer support for financial support for both phone and internet connection for staff. You know, we've continued having our 2-hour staff meeting, and then I do one-on-ones with folks, and some people do groups together, so they have time together to talk online about what they're, you know, to plan sort of what they're doing. I like the idea. We every summer watch a movie together, so we'll do that online this summer as well. And you know, maybe doing some kind of virtual staff retreat. We have 3 people joining us as interns in September, so we'll do something with the whole staff then. But our staff is part-time and works different schedules, so it's complicated to get everybody at the same time.
Great, thank you.
Yep.
And Vicky?
So we have meals delivered. I started, I recommended to each individual department leaders to have a First Friday Arts Murmur. We have it over here in Oakland all the time. It's just, you know, happy hour. And I really encourage managers to let people just take time off. I mean, when you're working from home, it's really, that line is blurred because you're always in front of a computer, whether it's your cell phone or whether it's your computer, and you know, there's no 8 to 5, period. And so I really try to encourage managers to, you know, if employees have done what they needed to do, let them take the rest of the afternoon off. Yeah.
Okay. I think especially, you know, we're now in summertime, and this is, I mean, at least kind of organizations where I've been, there's a lot of travel during this time. And I think a lot of folks have postponed that travel. We've been encouraging staff to take time away because we've all been kind of working in overdrive, and, you know, we need that time away from, you know, our computer screens, and you know, and I think the convergence of work life and personal life in one space is also has, you know, does become wearing, and staff do need to take that time away. So thank you. At this point, I'd like to open it up for any questions that any of our participants in the webinar may have. So again, as Jennifer noted in the chat, feel free to ask questions in the Q&A box.
Thanks, Imelda. And I don't know if you wanted to hear more, Letitia, from, I don't know if you wanted to hear more from Barbara about your question.
Oh yeah, I was asking her about the disaster relief fund. She mentioned that she would get some more information. I would appreciate that. Thank you so much, Barbara.
You're welcome. Yeah, I need to check in with our finance folks because it's a whole tax code piece that you need to cite.
All right, thank you.
You know, Imelda, I would like to hear, you asked the question earlier, but, you know, how are staff being celebrated and appreciated? I know that you just went over the question of, you know, how you're engaging, but are there any specific things like for birthdays or work anniversaries that you're doing differently now that this is a virtual environment for a lot of staff?
So one of our rituals is that we celebrate work anniversaries at every staff meeting. So we've continued to do that, but moved it to a virtual environment. This spring, we were going to have a spring fling. And so if any of my colleagues are on, you are now sworn to secrecy. But one of the things that we're going to be doing is we've kind of reallocated those monies that we would have spent on an organization-wide gathering to send care packages to staff. So those are going to be coming out soon. But also, I think that, you know, we take the opportunity, especially when we gather all of staff, to really highlight the hard work that we're all doing. So whether it's the grants team and their work went up exponentially, even more so than during the holiday season when SVCF has traditionally seen a spike in that department. It has far outpaced what would be a normal holiday season because our community is giving and giving more around COVID and also around social justice. And so I think that one of the things too is that the accolades come from all levels of the organization. So it's not only shout outs, you know, peer to peer, but also, you know, leadership team and executive leadership team being very cognizant and deliberate around appreciating staff, whether it's again in the all staff meetings or in team meetings. So those are, you know, some pieces that we've done at SVCF. And I think what I mentioned earlier too is adding the mindfulness app. We got a lot of really good responses and feedback. We added Headspace. And so that has, you know, it's provided staff with another tool to use now and also, you know, going forward.
And also, I just wanted to say another thing, like with Love Never Fails, throughout all of this, you know, what we're going through, it is very nice to work for an organization where we have actually promoted for people during this COVID-19 shelter in place. So if, you know, that gives anyone, you know, hope and inspiration, like, I mean, you know, it doesn't matter what we're going through on the outside, but as an organization as a whole, you know, if you're strong and you have that great team behind you, then, you know, anything is possible. And we just keep moving forward and pushing forward to help others, you know, and I'm grateful for that. And I'm thankful for this platform as well. I really like the work that all of you are doing for all the nonprofits. Thank you.
Thank you, Letitia.
Does anyone else want to share how they're also celebrating and recognizing staff during this time?
No, Rosanna already shared, I'm sorry. Any other questions from our attendees?
I think we might be good. So on that note, I do want to thank you, Imelda, for moderating the panel and providing us with a great presentation. And I also want to thank all of our panelists. You've all, you know, shared so much about what you're doing within your organizations, and we really appreciate the experience that you've been able to share with all of our attendees today. Let's see. So for all of you who join us, thanks again. You can actually, this is something new that I'm trying, you can actually take your phone and put your picture app over this QR code and it'll take you right to the evaluation. And as a reminder, when this webinar closes, you will be sent to an evaluation link. So again, check out svcn.org for our future workshops. The next one will be on July 21st. And let's see, if you have any questions or want to know more, send me an email at svcn.org. And I hope to see you next time. Thanks, everybody.